Like to recognize individually each of our Masters of Science students who are here today. So if Sarah Martin will come join us. What we are going to do is announce your name, read a couple of words about you and what you're up to. We would ask that you come up through the middle of the room so that you can receive a gift from the DGHI as well as have a picture taken. So that's going to be the process.
So our first student is Ifeoma Akaroda. If you could come up. Ifeoma is originally from Nigeria, and she came to the Master of Science program from the School of Medicine at Duke, where she'll graduate as well this weekend. Her research was the first truly lab-based project for our program and was based at the Duke and US Graduate Medical School in Singapore, looking at markers of febrile illness in Sri Lanka. She will go on to residency in pediatrics at the University of Virginia this summer. And actually, if we could hold applause until the end. So our next student is Edgar Ismael. Where is Edgar? Edgar is originally from Uganda and came to Duke from La Roche College in Pennsylvania. He has been a delight to have in the program. He undertook a very ambitious and fairly independent research project looking at safe male circumcision among young men in Uganda. Edgar is now working for Dr. Regine Preshold-Bell and the North Carolina Clergy Health Initiative as a researcher, and he's planning to head to medical school next year. Erin Clothes. Please come up. Erin Clothes is our first graduate of the Joint Master of Science in Global Health and JD program at Duke with the School of Law. And she is actually the reason that program exists. She came to us as an applicant to the law school and said that she wanted to do a joint program and made it happen at Duke, which has allowed others to follow her. Approaching us with a clear idea for combining global health and law, Erin has forged her own path, and her research focused on HIV control policies and implementation in North Carolina. In the fall, she'll begin working at Fulbright and Jaworski in DC in a position where she can really apply her unique skills in education. Her research mentor, Lynn Messer, shared that given her ability to accomplish more work in an impossibly small time frame than seemed humanly possible, she has the potential to make an enormous contribution to her field. Michael Dawnguard. Michael Dawnguard came to Duke from Lafayette College in Pennsylvania. For his thesis research, he joined a project in Honduras that evaluated pediatric oral health and causes of dental caries in both rural and urban areas, utilizing his Spanish skills. His mentor on the project, Dr. Dennis Clements, felt like Michael's time in the field proved that his enthusiasm and interpersonal skills will take him far. Michael will be searching for global health positions as he plans for his next steps. Jessica Hudson. Jessica Hudson has, as of this weekend, earned 3 degrees at Duke. And she has excelled in all of her studies here. She joined the first cohort of our program as a third-year medical student from Duke and quickly impressed all of us. She also maintained a strong commitment to the global health community at Duke, joining the DGHI Student Council and helping to organize both Duke and Triangle-wide global health case competitions. Jessica's research focused on barriers to surgical care in rural India, and she'll begin her residency in surgery at Washington University in St. Louis this summer. Christina Jelly. Christina came to the program as a third-year medical student from Duke and US Graduate Medical School in Singapore. She is the product of many countries, and her mentor, Ross McKenney, calls her the glittering face of new globalization. Her Her research was no less stationary, incorporating studies of cultural differences in patient perception and management of HIV-related chronic pain in Ghana, Ethiopia, and the United States. She will begin her residency in anesthesia this summer at Mass General in Boston. Victoria Kyer-Martin. Victoria came to Duke from Xavier University in New Orleans. She also took on a very ambitious and independent route for her thesis, researching mental health among women in 2 different clan groups in Ghana. And her mentor, Ross McKinney, shared that Victoria brought a true passion to her research, a passion based in part in her desire to understand her roots, as well as to build the scientific tools she'll need in her future career. This fall, she plans to continue her training in biomedical sciences at the Philadelphia College of Osteopathic Medicine. Elise Nelson. Elise came to Duke from the University of Virginia with a strong interest in ethics and the practice of global health. Having worked in sub-Saharan Africa during her undergraduate years, Elise sought new experiences for her thesis research, working with the Keenan Institute for Ethics to develop a project focused on mental health among a Bhutanese population living in Nepal and facing resettlement. Her passion for discussing this work has been clear this spring. While we don't know where yet, we look forward to maintaining Elise as a local global health colleague since she's looking for work in this area. Tulsi Patel. Tulsi came to Duke from Wake Forest University and continually impressed us with her focus and work ethic. She also worked in Nepal with the Keenan Institute for Ethics, where she focused her research on the role of caste hierarchy on mental health among the Bhutanese refugee population. Our time with Tulsi on campus was very short, and she completed her thesis while entrenched in her studies as a first-year medical student at Georgetown. Now a rising second year, she does plan to return to Nepal this summer, and we look forward to welcoming her back to Duke at some point. Amy Stopford. Amy is also a Duke undergrad and came to us after focusing on earth and ocean sciences. For her thesis research, she worked with Dr. Cheryl Broverman to evaluate the effect of commercial sanitary pad use on school attendance and health among young women in Muhuru Bay in Kenya. Having finished her studies in December, Amy has recently returned from an extended FIPSI-funded fellowship in Brazil, where she continued her research training and focused on the use of mobile technologies for mental health screening. We hope to keep her in the area as she identifies her next steps. Chelsea Widdle. Chelsea Widdle joined the Master of Science in Global Health after learning about Duke's program while working in Moshi, Tanzania. Her infectious smile, enthusiasm for work and learning, and tendency towards thoughtful reflection are very appreciated around our building. Chelsea, mentored by a former colleague, Kim Chapman-Page, joined an NGO, Carolina for Kibera, for her research in Nairobi, Kenya, evaluating the role of peer educators in adolescent sexual health programs. She's now working on program evaluation projects with Dr. Bob Malkin and Engineering World Health right here at Duke. And finally, Nirupa Mead. Nirupa Mead came to Duke from MIT and has impressed us with her incredible poise and capacity to learn. And this semester, we have witnessed her tremendous work as a TA helping Duke undergraduates master global health research concepts in countless office hours in Trent Hall. Nirupa Mead conducted a truly independent research project, identifying advisors across institutions and exceeding her recruitment goals. And according to her mentor, Christina Mead, has yielded important data for understanding assessment of HIV-related neurocognitive impairment in sub-Saharan Africa, which will result in several peer-reviewed publications. She will begin medical school at The Ohio State University in the fall, and we are certain, oh, there's been an update. Wherever she goes, we are certain she will be a tremendous physician. So. So thank you all. There is dessert, and I think it will be brought to your table, or you can go pick it up in the back. Right before 1 o'clock, we'll gather all of the students for a picture outside. But thank you for coming, and really, we're so proud of you, so thank you.
Thank you all.